I have a pleasure of introducing Dr. Amit Yadav, and he would be speaking on COVID-19 and SLT control in India. And he's a postdoctoral scholar and Center for Tobacco Control Research and Education, CTCRE at University of California, San Francisco. But he was also associated with me when he worked with Public Health Foundation of India, and he worked with Hriday, which was sister NGO associated with the PHFI, subsequently WHO and WHO FCTC Global Knowledge Hub for SLT. He was also elected member of the board of directors of the Framework Convention Alliance, representing CRO for 2016 to 2019. It's a pleasure to have you, Amit, with us today, and we look forward to deliberation. Thank you. Over to Amit.
Thank you, sir. Thank you for your kind introduction. I am presently working as a technical advisor with the Union Southeast Asia office. I've completed my postdoc at
Dr. Amit, there's an issue regarding your
Voice.
volume.
Be closer to the mic. Closer to the mic and
get closer to the mic. Yeah.
Thank you, sir. Am I audible now?
It's better. Can you make it still better?
I'm using my microphone. I don't know.
Go ahead, please. Yeah.
Is it better?
Yeah, it is better now. Yeah.
Okay. So thank you for the introduction, and I'm currently working as senior technical advisor for tobacco control with the Union Southeast Asia office. Completed my postdoc in July, in like June end, at the CTCRE and at UCSF. I'm going to talk about COVID-19 and SLT control in India, and I think the significance of tobacco control has already been pointed out. Smokeless tobacco use in India is in many forms. So we see that myriad varieties of tobacco SLT products are being used in India, and you see that there are a lot of them which are used. Next, please. Not only in India, but SLT use is also, this is, you can see that 140 countries and 360 million SLT users globally. So it is not only a problem that we should be worried about, but I think globally people should know that SLT use is also harming or in terms of affecting COVID transmission. Next, please. In India, 20 crore SLT users only live in these 13 states, which is again something that is concern for these governments, and the highest number of users in Uttar Pradesh, followed by Maharashtra and Bihar. So I think these are the states which need to take more care, where the majority of the SLT users of the country are living. Next, please. And what is important is that SLT use induces spitting. So that is, I think, the more significant thing that people should know, that if you are using SLT or anyone is using SLT, he is spitting, and spitting is the reason for transmission of COVID. Next, please. And if we look at the parallels in terms of the pandemic in the last century, and if we look at coronavirus, and it is the same, if you are spitting, you are actually transmitting death. So that's why I think it is important. And next, please. So and you need not only spitting, so coughing, sneezing, spitting, and in terms of shoots from nose, and so all of those can transmit COVID. And I think that is where use of SLT need to be banned, and even the product sales should be banned, and that's what has happened in India. Next, please. So the ICMR started with its appeal to the general public not to consume and spit smokeless tobacco. Next, please. And based on that, the central government issued guidelines and appealed to all the state governments to take necessary actions under Epidemic Act, the Disaster Management Act, Indian Penal Code, and Code of Criminal Procedure. And all of these were used, and several other provisions to make use and prohibit the sale, manufacture, and use of smokeless tobacco products and spitting in public places by different governments in the country. Next, please. Mostly what the state governments have used, one is the Disaster Management Act, and another was the Epidemic Disease Ordinance. So several states came up with the, in terms of their own ordinance, and followed the Government of India's ordinance, which empowered state governments and officials to take measures to prevent the outbreak or spread of disease. And taking effort, about 300 districts and 31 states and union territories issued specific directions and guidelines preventing SLT use and spitting in the country. Next, please. So these are some of the list of the states and union territories that actually banned spitting and sale of smokeless tobacco. Next, please. So what has happened is not only from the top down, in terms of guidelines and advisories by the ICMR and government, but also the bottoms up approach. The local authorities notified ban within their local power under CRPC and IPC, and took effort to contain the disease and using different legislations which are available. Orders by district collector and municipal commissioners, because they are local and the government mechanisms for enforcement understand well the means of implementing these directives. So they were complied well, and wide publicities of these orders were in terms of also given to ensure better compliance by the public. Next, please. So in terms of way forward, I think if we are reducing or if we are prohibiting sale of smokeless tobacco and ban on tobacco use, we are potentially helping to reduce transmission of COVID-19. It also prevent transmission of other infectious diseases like TB, and also help in our government's goal to eradicate TB by 2025. And it also help current users to quit and avoid possible new initiation. We need to, in terms of be very mindful now, and I think this is the opportunity, this is the time where I think we can call an end. And the theme of this conference is also looking at tobacco-free India by 2030. And I think this is taking in terms of this opportunity of COVID-19, taking this as an opportunity that we ban smokeless tobacco use in the country. That would be a great help in reducing not only the burden that we have from tobacco use, but also other infectious disease like TB and influenza and other in terms of communicable disease. So we will meet not only our NCD targets and go beyond that, but also in terms of help in curbing communicable diseases. Next, please. So these are some of the information that the state governments also in terms of notified and disseminated. Next, please. So this is my last slide, and you can see that during the COVID-19 period, how in terms of different states have worked. They have banned tobacco products, and while they have banned, the tobacco industry continued to come up with means of in terms of smuggling the product, and then making sure that they are available or they are sold. So I think that we need to also understand the tobacco industry is designed here, and the ban should be implemented strongly. And I think we should encast this COVID-19 as an opportunity to call an end to the tobacco products in the country. Thank you so much.
Okay, thank you so much.